According to the Journal of the American Medical Association, published September 26, 2017, Volume 318, Number 12, a study done of Canadian adolescents showed that 1 in every 5 kids reported having a concussion in their lifetime. Hi, I'm Mary Kate Simpson, and for someone who's seen concussions and how it affects not only teammates but also opposing players, I understand the relevance in not only just athletes but everyone as well. Today, I'll be informing the class on concussions by answering the following questions. What is a concussion? What are the causes and symptoms of a concussion? What are the treatment options? And also, what are the long-term effects? That brings us to our first question we need to answer. What is a concussion? A concussion, according to the article published by the Center for Disease Control and Prevention in February 16, 2015, entitled Concussion Signs and Symptoms, concussion is a type of brain traumatic injury caused by a bump, hit, or jolt to the head or body that causes the brain to move rapidly back and forth. So, to break down the definition, a hit to the head is not the only way to receive a concussion. You also can receive a concussion by any hit to the body that has enough force to make the brain bounce off of the skull inside the head, causing tissue damage and also imbalances of brain chemistry. Now that we know the definition of a concussion, we can move on to the symptoms that you may see. Based off an article from the Cleveland Medical Clinic on May 16, 2017, symptoms can appear between minutes and also hours after a concussion. The symptoms that are most commonly seen after a hit of a concussion include nausea and vomiting, balance problems and dizziness, double or blurry vision, changes in sleep pattern, and also overall fogginess, inability to pay attention, and also comprehend what's going on around you. 2 other factors that can also affect the symptoms or also your likelihood of receiving a concussion are age. Adolescents who have underdeveloped brains are more likely to see the severities of symptoms after a hit of a concussion, and also athletes. The Journal of the American Medical Association that was published September 26, 2017, Volume 318, Number 12, stated that over 300,000 reported cases of concussions with high school athletes for last year alone. Now that we know the causes, let's move into the treatment. Based off the article published in May 2017 by the Cleveland Medical Clinic, treatments can vary from extra rest and sleep to also total visual and sensory deprivation. The main points with treatment of a concussion is making sure that you understand what's triggering the symptoms, and you take those symptoms and you make sure that you're taking away the stimuli. So if audio triggers are what's affecting your headache and also your symptoms, but visually they're not, you need to make sure that you're taking away sound, but you're also allowing your brain to function visually. But one of the key points with treatment is making sure that you do not take any pain medications prior or right following after a hit to the head. This is due to the fact that symptoms may appear minutes or could appear hours or days after a concussion, and they may even worsen. So when you take those pain medications, you're dulling the senses in your brain, and because a concussion is not a tangible thing like a broken bone or a bruise, you're unaware that your concussion is getting worse and more brain damage is occurring. However, some people don't receive any treatment at all in hopes that the concussion will just get better, and that leads me to my last point, which is the long-term effects of a concussion. According to the Weill Cornell Medical Clinic article published in 2013 entitled Long-Term Effects of Brain Injuries, those who do not receive immediate medical attention following a hit to the head or also to the body, as we stated earlier, is putting themselves in a position to receive post-concussion syndrome, which is when somebody who does not treat a concussion the correct way, it's almost as having a moderate concussion amplified by almost 10 times that amount. And it can lead not only to symptoms days, months, even years after the concussion is initially received. To summarize, concussions are the result of a bump, jolt, or a hit to not only the head but also the body. Symptoms like nausea, sleep deprivation, blurry or double vision can appear minutes or hours or days after the initial hit. The treatments vary depending on what symptoms someone is experiencing and also how to take away the triggers for those symptoms. And if one does not take treatment into their own hands at all, then long-term effects such as post-concussion syndrome may be experienced. So with that being said, you're able to understand what a concussion is and how to deal with it if one is experienced. That way you don't end up like the 1 in 5 adolescents that have reported a concussion in their lifetime. Thank you, I'm Mary Kate Simpson.